I'm really excited to be here to share our experience here from Western Australia. So before I start, I'd like to pay my respects to the traditional owners of the land that we're meeting on here in Western Australia and across Australia, and to their elders past, present and emerging. So just a little bit about us here at Telethon Kids Institute. It's the largest research institute in Western Australia and the second largest child health research institute in Australia. It has a 30-year history, and currently we've got about 750 staff and students working from various places around Western Australia, because we have not all returned to work yet. So we've had a formal engagement and involvement strategy since 2004, and today we have more than 400 community members, which you would call patient and public, across the organisation in involvement activities and serving on committees, etc. So I think the key ingredients to our success have been our senior level champions, who have not only endorsed our program but also provided over a long period of time funding for dedicated roles, training and resources. And at the Institute, involvement and engagement of the community is a strategic goal of the organisation, and we are very fortunate to have strong community and patient networks across the state. So next slide please, Ollie. So I'd like to introduce our engagement team, and that's myself in the top left-hand corner, and then Belinda and Danny. You can work out which ones they are. The three of us work together, and so I'd like to just share about how we responded to COVID-19 research. So in March 2020, I had had a couple of queries from researchers both here and in New South Wales about accessing community members that could have some sensible discussions around, things like ICU beds, and if there need be about, how we would deal with that. We've been lucky enough not to have needed that here in this country, but there were concerns about that. And then myself and other consumer advocates from across the country were concerned about the lack of involvement we were hearing in research that had been rapidly developed. So I spoke with my bosses and my team, and we invited 20 experienced community advocates from across Australia to join together and form a national advisory group who would provide input into the rapid COVID-19 projects that were being developed. So next slide please, Ollie. And I'm really pleased to say that 19 of the people who were invited, took it up. One person who couldn't was due to personal issues and someone being in lockdown in a nursing home. But within a week of inviting people, we had 19 members on our advisory group. We developed terms of reference and confidentiality agreements that everyone had signed off to. And so then we had, as I said, within a week, we'd had 30 people attended a virtual meeting. So, I'm really pleased to say that in the intervening time from the beginning of April until now, the advisory group has provided input into 17 projects, locally here in Western Australia, nationally across Australia and internationally. There have been a range of projects, clinical, laboratory, mental health, infectious diseases and health promotion projects. And we've also asked the members to give their priorities for future research. We've held 8 virtual meetings and we've had hundreds of email traffic backwards and forward. And this group have provided 250 cumulative hours of input into those various research projects. Next slide, please, Ollie. So the people that are on the committee range in age from 20 to 70 plus. And they are, as I said, from across Australia. The majority of them are from Western Australia, but we do have members from Canberra, New South Wales, Victoria, Tasmania and Queensland. And they have a range of health interests about heart disease, lung disease, disability, mental health, cancer and Aboriginal health. So when we were inviting people, we were really looking to get a broad range of perspectives that people would bring to the conversations that we were having. So I did ask a couple of our members, and you can see here the sort of comments that we got back from both Kath and Amber, and we've had similar comments from everybody. But basically what they've been saying is that they were both really pleased to see researchers working together with the community to ensure that the research being done would be of maximum benefit to the community, and also that they were really seeking to partner with consumers and that their views were respected and appreciated even when they differed from those held by the research team. And at times the conversations have been very robust, particularly when you've been talking about secondary use of data and storing, etc. So next slide please, Ollie. And in the interest of being fair, I thought it was reasonable to go back to the person that started this conversation with me way back in March, and that is Tom Snelling, who is an adjunct researcher at Telethon Kids and recently moved to the University of Sydney. And he is doing a clinical data analytics platform project, and which aims to improve the management of for patients by learning what is from the previously treated patients. And he said that, you know, the advisory group provided important independent feedback on a number of issues. And whilst I haven't included it there because he gave me a very long spiel about how good it had worked for him, but he thought particularly regarding the collecting, storing and making secondary use of clinical data for research purposes, and what might be considered reasonable versus unreasonable use of that data from the community perspectives. And they found that to be particularly helpful. And then, of course, some members of the advisory group also provided advice about the content and design of the website that they were developing very rapidly. And they, the committee really highlighted that, you know, these websites needed to be, you know, the community needed to be able to identify them as something that was trusted, so that because there was so much information and still is so much information that's probably not as good as what we would all like to see. So, you know, that's just giving you a couple of perspectives from, you know, each side of the consumer and the researcher side about how they felt the group that's moved. So last slide, please, Ollie. So just in reflection about, you know, what's enabled us to facilitate a group from across the country, and Australia is a big country, to provide rapid community input into the COVID-19 research. I believe, you know, the team that I work with, we were very responsive to the urgency of the situation. We are very supported and trusted by the Institute's leadership team and senior researchers both locally and nationally, that we, and when I say trusted, that we are able to deliver on actually getting good community input into research. And also I really lastly believe that we leveraged on our existing relationships with consumers and community members across the country and their strong commitment to community engagement in research. And I think it's fair to say we certainly had some challenges along the way. We had to learn about holding meetings via virtual technology. We had different time zones. There's, you know, different time zones across Australia. People not knowing each other, which is very hard when you're working, you know, in this virtual area where nobody knows each other really. So that was challenging, and a lack of funding. We didn't have any money when we began this. We generally, you know, work with paying people for their contribution to as consumers and community members, and we didn't have any money for this because philanthropic money across the world is drying up rapidly for research. So my boss has said, yeah, go ahead, Anne, but we've got no funding for this. And everybody said, we don't care about the money, we'll just do it because we want to contribute. So I think, you know, it was that collective will of everybody that we would, you know, we wanted to come together very quickly and do something, you know, that made a difference wherever we could. And I think, you know, just in closing, our example may be a small initiative to some. You know, we're a very small country, a very small place. We are a country because we're locked down from the rest of Australia at the moment. But, you know, it's small compared to, you know, the bigger countries and the bigger populations, I should say, in the UK and Europe and Canada, etc. But I really believe that it's something that everybody could have a think about, you know, and it's about that will to make a difference and come together and just really do something, even in, you know, given the urgency of the situation. So I just like to thank every one of our community members. They have been awesome, the people that I work with, of course, and the researchers, etc. So thanks a lot.